There was an interesting article in the journal Health Affairs in which 2,000 physicians responded to a survey. And it's interesting what they revealed. 2/3 of doctors agreed that they need to disclose medical errors to patients. 1/3 did not completely agree with that statement. 2/5 of the doctors who responded did not completely agree that they should disclose their financial relationships with drug and device companies. So obviously you can't have patient-centered care with that kind of compliance and attitude. 20% had not disclosed an error in the last year. And they hadn't because they were afraid of what? Of getting sued, of course. 55% said they often or sometimes disclosed prognosis in a more positive light. So they painted it much better than the actual condition was. Interestingly enough, women and minority doctors were much more open, honest, and transparent. And so obviously this really goes to the heart of your medical care, the doctor-patient relationship. And so if you've had any kind of gut feelings about your physician, about, maybe something's not right, should I be looking at other doctors to consider? You might want to consider a few of the tips that we offer in the written blog. Consider a patient advocate who can help you navigate the healthcare system, ask the right questions. There are others who can actually help you decipher bills and do that piece. The patient advocate is more there to make sure that you're receiving the care that you need and asking the right questions. Ask your doctor to disclose relationships with drug and medical device companies, because he may be prescribing something to you because he has an incentive to do so. For our older population, consider a geriatric care manager. Caregivers can hire these, keep a check on mom and dad, and coordinate their care, especially if you live at a distance. And it's also important to know where most medical errors occur. A lot of them occur in the hospital. Of course, there's always medication errors. Errors that take place because of bad communication, infections, falls, surgical errors, pharmacy errors, lab errors, treatment errors, and then of course errors in follow-up care. So you need to be aware of the type of errors that occur, because these are the things that you'll want to know about should something happen and you feel you're not being truthfully told what's going on. But interestingly enough, 1/3 of physicians don't necessarily agree they disclose medical errors to you, and 55% of physicians paint your diagnosis in a better light. Trying to spare your feelings, I guess, but in my case, just give it to me straight. I want to know, right? Because you want to plan. So just something, things to keep in mind for you. Thanks.